Today we will study the AIDS disease. We will cover following topics in this lecture. First, we will see what AIDS is. We will study the definition of AIDS. Then we will see what the causes of AIDS are. Then we will go to how AIDS spreads. What is its transmission? What are its risk groups? What are its signs and symptoms? Then we will see how its diagnosis is done. After that, we will see how we can prevent AIDS. Then we will study the treatment of AIDS. If someone gets AIDS, what is its treatment? So let's start. First, we will see what AIDS is. Let's read its definition. First, let me tell you the full form of AIDS. It is acquired immunodeficiency syndrome. Whoever gets AIDS, their immune system becomes very weak. It becomes so weak that they get not only one disease, but many diseases. Why is this? Because their immune system is weak. If any infected organism enters, their body cannot fight against it. Due to this, they get many diseases. That's why we call it a syndrome, not a disease. Its incubation period can be from a few months to 10 years, meaning until a person gets tested, they do not find out because symptoms do not start appearing in the person. According to the report, there are currently 37.9 million infected people with HIV in the world, meaning 37.9 million people have HIV. And so far, due to HIV, 25 million people have died. Now we will see what causes HIV. Now we will see what causes AIDS. AIDS is caused by the HIV virus, whose full form is human immunodeficiency virus. There are two types of HIV. HIV-1, HIV-2. As you can see the figure of HIV in front of you. Now we will see what its risk groups are. The risk groups for HIV infection are people who are sex workers. And if someone has sexual intercourse with them, if they have HIV, then the other healthy person will also get HIV, meaning AIDS. The transport workers are also in the risk group because they stay away from their home, family, and wife for months. That's why they engage in other sexual intercourse, so their chances of getting HIV increase. Other healthcare workers, because they treat people, are on the front line all the time. If someone has HIV, the healthcare workers can also get HIV. Military and police also have increased chances of getting HIV. So, these are all the risk groups for HIV infection. These people have a higher chance of getting HIV. Now we will see how its transmission occurs. Before transmission, let me tell you that the HIV virus is present in blood. Semen is the fluid that comes out during sexual intercourse. CSF, breast milk, saliva, tears, and urine. HIV virus is present in all of these, but it spreads from one person to another only through blood and semen. Its transmission happens from an HIV-infected person to a healthy person only and only through blood and semen. Now we come to signs and symptoms. If someone has AIDS, what symptoms will they have? They will lose weight. They will have a fever. Their pharynx will have inflammation. Their lymph nodes will swell. Their muscular system will weaken. Their liver will enlarge. They will have headaches. They will have mouth sores. Their spleen will enlarge. They will have gastric problems, vomiting and nausea, etc. Their skin will have many rashes. These are all signs and symptoms of HIV. Now we come to how it is diagnosed. If someone has HIV, meaning AIDS, for this we do two categories of tests. One is the direct test and the other is the indirect test. In the direct test, there are four tests. The first is recombinant DNA technology. Using recombinant DNA techniques, we detect HIV. The second is PCR, polymerase chain reaction. The third is the ELISA test, enzyme-linked immunosorbent assay. And the fourth is viral isolation in culture. These four tests are in the direct tests. The indirect test, their list is lymph node biopsy. The second is lymphopenia. And the third is CD4 counts. These are the three indirect tests. In this way, we can diagnose HIV. Now we come to how we can prevent ourselves from HIV. How we can give awareness to people so they can avoid HIV. How we can protect people from getting HIV. We give them awareness that they should use condoms because if someone has HIV, has AIDS, they will use a condom during sexual intercourse. So their chances of getting HIV will be greatly reduced. If someone has HIV and they use a shaving blade, needle, or syringe, and the same syringe, if another person uses it and the same shaving blade is used by another person who does not have HIV, in this way, HIV is transmitted from an infected person to a healthy person. If someone has HIV, if they donate blood to a healthy person, they will also get HIV. Rehabilitation of HIV cases. And fourth, strict sterilization techniques in hospitals and clinics. That whatever things are used in surgery or other places, they should be sterilized properly so the HIV virus in them dies and does not transmit to other people. Now we come to treatment. That if someone gets HIV, what is the treatment? In 1987, the treatment used to be done through nucleoside analogs. This does not eliminate HIV, it only slows the growth of HIV. After that, the second treatment that started was through protease inhibitors. This only decreases the level of HIV, not that it eliminates HIV. The third treatment that started in 1996 was with NNRTs, non-nucleoside reverse transcriptase inhibitors. In 2006, another treatment started, Atripla. This is a drug, a combination of Sustiva and Truvada, a combination of these two drugs. Question of the day. What causes AIDS? Only a genius can answer in the comments below.